Okay. All right. So I think we're in good shape. Good morning. How are you today?
I'm fine, thanks. Good morning.
Well, it's good to see you again. Tell me, how are you feeling since your procedure?
I feel absolutely wonderful. I feel
Yeah.
great. My energy levels are back. I had lower pain in my back that's gone. I feel wonderful.
Okay.
Um,
Tell me a little bit about your symptoms again, and what you were going through, and why you're potentially waiting, and not wanting to have that hysterectomy procedure.
so I initially discovered that I had fibroids. I have a 21-year-old. Well, he'll be 21 December the 27th, and he was a C-section, a cesarean baby. And so I was told then that I had fibroids when they were in there. This was after the procedure, and that they were small, and I wasn't having any issues at that time. So I've known about them for quite some time. And I'm 52 now, and had the procedure in April, shortly before my 52nd birthday. But just years later, of course, started to have problems. I didn't realize that the symptoms I was having was actually from the fibroids. So I've always been active, been able to get up and walk and jog a little bit, do certain exercises. I was having a lot of, bulk symptoms around my midsection. I just felt like I'm gaining this weight. I can't lose it. What's going on with around my midsection? Things would, fit around the hips, and for some reason having problems getting things buttoned, and tying my shoes would be very difficult, just bending over. So a lot of symptoms there, the heavy bleeding every month, which I thought, well, maybe I'm starting to go through menopause and this is just part of it. A lot of the bleeding, and having to just to move a certain way. I wouldn't be able to exercise during my periods because the periods were so heavy. And it was really kind of confined to my home during that time. And then I was noticing that I was having back pain. I actually was going to the chiropractor for the back pain because I thought that I'd hurt my back. And I was doing all this stuff, seeing the chiropractor, and so finally discovered, or made an appointment with my OB, and she said, "Hey, your fibroids, they're really big, and it's something that we need to take a look at." And she immediately recommended a hysterectomy. That didn't sit well with me. So I was raised by my grandmother, who had she had given birth to nine children, and she passed away in 2020 at the age of 93. And when she passed away, she had her uterus. And so I just remember thinking about that, like, there's got to be something else that we can do, and this just seems like really drastic. And so, it just kind of coached into that. What my OB was talking, or the gynecologist was talking to me about that. And she made it seem like, hey, it's, not a big deal. But again, just something that didn't sit well with me. Made an appointment with a primary care physician, who did an examination. And also, that was the first thing he said, like, oh, just, I thought, well, let me go to him and I'll get a second opinion. Yeah, you just need to have this done. This will relieve all the symptoms. And, these are only going to grow and get bigger. And so still didn't sit well with me. I just did not I started to research the side effects of actually losing the uterus. Like, I feel like so many of us, we don't do that. We don't research. I know there are benefits. They've told me about the benefits, of course, to losing the uterus, having that removed, but I wanted to know the side effects. And when I started to research the side effects, I just thought, this isn't something that I want to do. So I actually started to research more of what the alternative would be, to having the hysterectomy, because I felt like it was just something that,
What what did you read as far as side effects for the hysterectomy? I'm just curious.
well, I read that it would, of course, immediately, I had not reached the menopause phase. And I read that it would immediately, of course, throw me into menopause. I read that, of course, there's 6 weeks. It's considered a major surgery. So you're down for 6 weeks with that. I read that can be some depression that comes along with that afterwards. And I read that, of course, the depression that comes along with it. I had read that you can have issues later with your pelvic floor, because that organ isn't there. with, your other organs kind of moving around in the pelvic floor, coming down. And so, and then I'd read that there could be sexual dysfunction from having the hysterectomy. I actually had a friend who, prior to me ever having any of these, these symptoms being as severe as they were, who had had a hysterectomy, and she had confided in me that she was having some dysfunction. And this was actually years later after the hysterectomy, and that how it affected her in terms of the sexual dysfunction. So just some of the things that I didn't want to risk having happen to me. So I started to do a little bit more research.
Now, did your OB/GYN tell you any of these things before, you know?
No, absolutely not at all. Nor did my primary care mention any of these. They actually, they were, seemed like that it would be just a very positive, easy experience. Just, pretty much like, hey, if we just remove the uterus, that's, that's gonna, then you're not gonna have any other issues for the most part.
Okay. Well, then tell me a little bit about how you found me and about the fibroid procedure.
So just again, Googled, researched on my own alternatives to hysterectomy, and started researching uterine fibroids, and I started actually to look for more holistic ways. I'm like, maybe if I change my diet, cut out the chocolate, don't drink coffee, what can I do? What is it that's causing these fibroids to grow at this, I've had them, but why now are they growing at this rate, and why are they, why am I having these problems? So I actually started researching, looking for something that perhaps would be more of a holistic approach to resolving the issue. And then that's when I discovered uterine fibroid embolization, and just started to read more about that. And, I thought about it, and I thought, for me, I looked at it like, well, what do I have to lose? So if I try this procedure and this works, which I can't thank you enough. I feel like I really I know I've said thank you like a million times, but you have no idea, like for me, what this has meant for me. But yeah, so I started to research, and I just felt like, this is, if I end up having to have the hysterectomy, then I end up having it, but I've got to try. I just felt like I've got to try to save my uterus. And so that was the position that I took. And so when I started to research this procedure, being an outpatient procedure, so I knew that, because I'm like most women, I work a full-time job, I have a family. And so with this procedure, this was an outpatient. So I took off work maybe, I think I was off work maybe 3 days. And that was because I actually felt, I work in an office, so I felt like I was capable to go back, but I just wanted to take some time to be with my family and to just kind of recover from that. So researching the procedure itself, minimal risk, and being able still to go through menopause naturally, rather than being thrown into that with a hysterectomy. There were just so many positives to it. And so I felt like that this was definitely the procedure for me. This is what I wanted to do for myself.
A lot of my patients are waiting so long to even come out. The average patient's waiting about 4 years before they even decide to get any kind of treatment. Tell me a little bit about your journey on when you decided that you needed something done. Then how long did you wait or was it before you even found the by procedure as an option for you?
Yeah, I waited. I mean, I lived the way that I just described to you. I might have been on my third year of getting up, going out to do a workout. I love to run, and starting knowing that, I'm at what I do, just my regular routine, and struggling with that. That for me was, and I couldn't figure out why, trying to get on the scale to think, well, is it because is this the weight that have I put on weight, and just not being able to do a lot of the things that I enjoyed doing. So for me, I waited because I just I couldn't, it was one of those things where I just didn't know. And so what we tend to do, I think, as women, is we tend to try and improvise. So that's what I did, so I shortened my workouts, definitely wasn't able to run at all. So I'd walk and then I'd have the lower pain in my abdomen, the back pain, and then I just kind of push myself a little bit. And same thing like with the periods. I would just, go to work. I mean, I probably try to carry almost a box of pads with me, just to be prepared for any accidents. We tend to do things like, at night when the bleeding's really heavy, maybe sleep with a padding or a towel or something like that in your bed, because you know that if you're bleeding to that extent, that there's nothing that's going to be able to contain that. So there could be an issue where you're having accidents. So I did we tend as women, I think, to improvise rather than, address the issue, just because we're busy. We've got our day-to-day lives that are going on. My periods were longer too, much longer. So this would go on anywhere from 7 to 10 days out of the month. So, yeah.
How would it how did it affect your social life? Were there events that you would skip? Were there things that you were doing and avoiding during those periods during the month?
Absolutely. Absolutely. It would start with trying to find something. For me, I had a lot of the bulk symptoms. So for me, it would start with, what's up with my wardrobe, to just being exhausted. I was really tired a lot. And now I know that's obviously from being anemic. I was diagnosed with anemia, and I just didn't realize that was related to the fibroids. So definitely interfered with my social life, and just not having the energy, not having the motivation, just overall not feeling good about yourself. Um,
When
so-
when were you diagnosed with anemia? How long ago was that? The
oh,
one
I've been diagnosed with anemia for probably 10 years ago.
and
Um,
in all this time, 10 years, nobody made the connection that you're anemic because you're just bleeding too
no,
much every month.
no, there's absolutely no connection to that at all.
Tell me about what kind of workups you were getting. What were your doctors telling you about why were you anemic?
Yeah, just, I don't eat a lot of red meat. So I'm a fish, chicken, and type of an individual. And so we just kind of discussed, hey, maybe I need to add more things into my diet, to try and address that. So I wasn't anemic to the point where I needed like, transfusions or anything like that. But I was definitely, when I would go for my physicals and do the blood work, I was definitely considered to be anemic. So I was doing the iron supplements, which, as we know, for me anyway, they cause a lot of constipation. So I would tend to do those and then not do those, because then there was that other result to that. So just kind of the same thing, try to struggle through that. I try to do things to modify my diet and, take in more iron, but ultimately that was none of
That's not
that
what. Do
resolved
you
the issue.
remember what your number was? The hemoglobin number? It's
You
it's
know what?
usually
Yeah,
like, so normal for adult is supposed to be 12 to 15. Do you remember what your number was?
I don't remember.
Okay.
It
No.
was just one of those things where, it was something, it was I don't remember what the numbers were, but definitely something
Yeah.
that
Yeah.
struggled with for a while.
Yeah. Yeah. Well, with the symptoms, I could tell you that you probably throughout your adult life, you're probably never at 12.
Okay.
Yeah, because now you're probably there. So let's go to the procedure. Give me an idea. Tell us about like what your experience was like with the procedure. What was the worst part of the UFE procedure for you, and what the experience was kind of like?
So the experience for me was fantastic. I'll be honest. So for me, it was making the consultation, scheduling the consultation with you. And as a lot of us as women tend to do, we go into the office. The first thing we look for is to make sure that the office is clean. And, I've already researched your credentials. I've already called the insurance company to make sure that, it's going to be covered. So I've done covered that aspect of it. And so it was going into the office, state of the art. Um, your office was completely above expectation in terms of, do I feel safe here? Is this place clean? And And so went to the consultation with you. That was just a really good experience. I felt like you took your time. I didn't feel like, we're rushing through this. I'd done a lot of research. So I had a lot of questions, all of which you took time to address. And I met your nurse that day. I was introduced to her, and she sat in the consultation with us. So for me, that was a very positive. I knew from that first meeting, I knew that when I left, I was convinced that yes, this is what I want to do, absolutely, and this is where I want to have the procedure. And as I stated, because you answered all the questions I had. You were extremely knowledgeable. Obviously, I thought that I was the expert before having the meeting with you, but then I knew then that, you had no issues with, answering any questions or anything like that I had. And I felt like I said, that you were an advocate for me and what my choice was. My choice was to not have the hysterectomy. And now I'm sitting here with someone who also was saying, yes, so I did have my images. I had, of course, my MRI, and you had access to my images. And after looking at my images, you confirmed that, yes, this is something that I can do. And, pretty much now I've got somebody here who understands what my needs are and how I want to live my life, what the quality of life that I want for myself, and who's telling me, yes, I'm an advocate for this, for you, for this procedure. We can get this done. So that was my experience. Initially, that was my experience.
And then what about the procedure, going through that whole procedure, then post-procedure?
Oh, same thing. It was an awesome, getting there and being completely, I felt like I was catered to by your staff. I felt like that any questions I had or anything like that, I was, people heard me, and you guys took very good care of me. I will say that. The procedure itself for me, you're, of course, you have mine was radial through the wrist. And so I didn't have any issues with that, with the incision or any pain or anything with that. The procedure itself, I thought, went rather quickly. Of course, I was under, so I don't recall having, I had some pain subsequent to that, to the procedure, of course. And I was told that was just the fibroid starting to shrink, and, my body adjusting to that. Getting home, I'll say that I was, of course, prescribed some medication for the pain. I'm not a big proponent on just me, myself, on a lot of pain medication. So I was on the pain medication 2 days. After that, I started Advil. I mean, my pain was very manageable, that I felt like, okay, I'm good. I can, start taking some Advil. I was probably, of course, the day of the procedure, lots of rest in the bed, asleep, kind of, in that recovery phase. Day 2 for me was, kind of up, walking around in my home, able to do just a few things. I felt like I really, during that time wanted to take really good care of myself. And so I didn't, push it. And then that Monday, I was back to work. And there is some after the procedure, there is some pain associated with it, but for me, it was very manageable. For me, there was very light spotting. So there was no, I was worried about that, like, okay, will there be heavy bleeding after this procedure? I had very light spotting after the procedure. And so, yeah, so for me, it was the pain, but for me, it was manageable. I will say after the procedure, I lost my appetite for all the sugar. I immediately, for me, after the procedure that week, I had this burst of energy. And I think I may have had, when you called, of course, because that was another thing too. You called to check on me, right after the procedure as well. And I think you and I had spoken about that. And I told you, I said, I have this energy that's come from out of nowhere. I don't feel groggy when I wake up. I don't wake up tired. I wake up feeling motivated and, wanting to get out of bed. For years, no matter how many hours I slept, I woke up, I would just be tired. and tired throughout the day. And I would tend to have these crashes midday, where I would try and supplement that with coffee. That went away. It was just a lot of amazing things for me, life-changing things that started to
Okay.
happen.
And then give us an idea of like how soon after the procedure did you start feeling some of these positive things?
The energy for me was right away. So I don't know if that was due to the blood loss or the energy. I'd say within a matter of the week of the procedure, the energy level changed. The sugar cravings that week, there were certain things that I just didn't have a craving for. Now, of course, I felt like I could exercise around the second week, third week. I did a little light walking, but I felt like I could do more, but I didn't push myself to do more. I wanted to make sure I did what I was told in terms of the recovery phase. But the bulk symptoms, now I'll be honest, the bulk symptoms, it took a little while. That was probably that was probably about a month. And then I started to notice around my midsection that it started to go down. And there were times throughout the day where I could still feel the fibroid shrinking. So I might have like a spasm here or there in the midsection. But then I would call the office, spoke to the nurse, spoke with her about some of the symptoms I was having, confirmed with me, hey, no fever, no other issues. Okay, so you're fine. That's most likely, and if the fibroid shrinking, if anything else happens, make sure you call us or call your doctor. But today I have absolutely no symptoms, none whatsoever.
And how far out are you now? Like how long has it been since we did your
So
procedure?
I'm month 7.
Months. Okay. All right. And so
Yes.
energy level. So you're back to as far as your health. How far back do you feel like you're back to when from a chronological age perspective? How good do you feel like when you're how young? Because a lot of patients will tell me that. So.
Well, I'm 52, but I'm telling you, I feel 35. I feel
Yeah.
great. I'm telling you, I had no idea that my quality of life was as bad as it was until after all of these symptoms started to subside. I feel absolutely fantastic. I feel, and I don't want to stress this, but for me, again, the bulk symptoms, just how I look in my clothes, I'm not having to, do things like, unbutton my jeans in the middle of the day. A lot of that subsided. Bending over to tie my shoes and not feeling like, oh, I'm going to pass out just because of the bulkiness in the midsection. My midsection had gotten fairly large. So a lot of that has completely gone. The energy levels, I run now. So I had stopped running. I hadn't ran for probably 3 years, 2 or 3 years. I was able to walk and I try to run a little bit. Now I'm able to get out physically and there's not anything that I want to do now physically. I'm capable of doing that.
What
Uh,
about like mentally, concentration wise, mood wise? How has that changed, if any?
oh, wow. um, Again, I mean, I'm 52. I'm still having my periods.
Mm.
So I'm actually happy about that because I wanted the onset of menopause to happen naturally, rather than have the hysterectomy and be thrown into that. So that for me is, and my periods I'm having absolutely no issues with them. We're talking maybe 3 to 5 days and very unbothersome. I mean, they're very light. And so mood wise for me, it's just not having to, I still have my uterus. I mean, I'm a woman. And for me, it was important for me to do everything that I could um, to maintain all of my organs. I'd like to keep everything if that's, if that's possible. But I'm so much happier. My quality of life, like I said, having the energy, I feel like my wardrobe fits better, my midsection. I was actually considering at one point, like maybe I need to have some sort of a liposuction or something like that, because I had no idea. I'm like, what's going on with the midsection? And then you're reading all this stuff that says, oh, well, when you get past a certain age, it's normal, obviously, for you to gain weight. And that is normal, but not to the extent that I had this issue. And so, yes, I feel much more confident, lots more energy. My periods are normal. They're still here until the onset, of course, of menopause, and I naturally progressed through that. So for me, it was a life changer. Absolutely changed my life.
That's so great to hear. It's awesome. If you had to, you know, talk to younger African American women, you know, what would be your message now with respect to their periods and uh, going through what you went through? Would you have a message for them that we can share?
Yeah, I'll be honest. My message is do your research. There for me, it appeared, and this was from my experience, that I just kind of felt like for me, if I made the decision to have the hysterectomy, that was something, whatever the symptoms were, in the end, that would be something that I would have to deal with. And so for me, I felt like that it may be the easiest way to rid. It may have been what some people thought would be an easier way to rid myself of the issues that I was having, but it wasn't. It wouldn't have been an easy way to rid myself of the other issues that I would have had subsequently to removing my uterus. And so I would just tell them that definitely this is, what do you have to lose? So if this is something where, you're being told that, and coached into having a hysterectomy, stop, just wait, do some research, go to the office, get the consultation, have the doctor to actually look at the fibroids, the size of them, get an expert's opinion about whether or not that is a drastic surgery. I mean, it's drastic, and you cannot turn back from that. Once you make that decision, once you have a hysterectomy, there's no changing that. And whatever the consequences are to that surgery, those are the consequences that you will have to live with, not the person that removed your uterus. And so just go to the consultation, get the information. I'm here to tell you that it completely changed my life for the better. I feel
That's awesome.
great. It's a decision that I made that I'm thankful for it every day, that I did not make the choice to have a hysterectomy.
Yeah, no, that's awesome. You know, it's really interesting. Like our home city of Cincinnati, if I were to tell you that we we do about 75 to 80 hysterectomies per month in the African American community for fibroids, you know, what would you say? Did you have any idea that
Wow.
like
Well,
like
I
a,
researched that. That was one of the other reasons why I decided not to do this. I'm like, okay, is there some sort of a mission is it just easier, you know, and in the medical industry, is it just easier for us as women just to remove our uteruses? So then that way there's not any issues for, I don't know, for the medical provider. I mean, I just felt like this is so serious, and it was shocking to me to discover. It was just something that I hadn't thought about. I hadn't had to think about during the childbirthing ages, of course, because you've got all your girlfriends, and obviously this isn't, unless there's a serious issue where someone has obviously no other choice. But it just seemed more of like we are electively having this procedure without these hysterectomies, without actually doing more research to see if there are any other alternatives to that. Um,
yeah.
so so yeah, I would just
Do you
really
feel
take.
like some of the issue is that there's a cultural norm of just living with heavy periods and symptoms, and folks not, you know, like since within one community, folks they kind of normalize things based on what they see others dealing with. And, you know, I get this a lot from my patients. they'll say, well, you know, doc, everybody in my family's had a hysterectomy. So I just thought, okay, this is what we needed to do. And, you know, I didn't even know I was living with heavy periods and these symptoms.
That's absolutely the case. After having the consultation with the doctor who recommended, the gynecologist who recommended that I have a hysterectomy, I started to kind of ask around. And I had a couple friends that had confided in me that they had had history. So many African-American women, so many of women in my family, so many of my friends had already had hysterectomies, had not ever heard of fibroid embolization, uterine fibroid embolization. So that was really difficult for me because I had lots of people in terms of friends and family that I could discuss having a hysterectomy with. I had, other than you in your office and YouTube, and I had absolutely no one that I could speak with about this procedure who knew anything, could give me any personal information about it. And so that for me, you know, it was just, yes. So it seems definitely like in our community that that is the norm, that we're not discussing having these symptoms and not discussing having the, you know, the bulk symptoms, the heavy bleedings, and then when we are having our visits, then it's just recommended immediately, like, well, you know, this is what the problem is. It's the fibroids. Let's just go ahead and remove the uterus. And so pretty much that is, I feel like that is the social norm right now.
Well, okay. Last question then. What do you think needs to happen? You know, if you were me and you had infinite resources, how would you tackle this educational issue in the community? I'm just curious.
We need to start talking about it. I myself, I've already, my hairdresser has had a uterine fibroid embolization. She's on month 2. We're the same age, and we have known each other for about 25 years. And I actually, after the procedure, sat in her chair and we were talking. And of course, hey, have you had any, she'll ask, have you had any medical changes or anything like that in terms of medications or whatever? Sometimes if she was coloring my hair. And so they'll ask sometimes just a general question like that. And so I told her, I said, you're not going to believe this. And because prior to, we had both discussed having fibroids. And I said, I found a procedure. She had actually she had done a little bit of research, but she had said that she had just been, her gynecologist had recommended the week before that she have a hysterectomy. And so I told her, I said, I just had this procedure. I gave her the information. And yeah, and so she did some research, scheduled an appointment. And yes, so I'm learning now that we've got to share the information. We've got to share what our experiences are. And we've got to, it's just the unknown. I'll be honest again, there was no one that told me. For me, I discovered this because I knew that, yes, I was having severe symptoms, but I just felt like this is drastic. Having a hysterectomy is very drastic. And I didn't feel that it was a drastic circumstance that warranted removing my entire uterus. And so that's what caused me to do the research. But now I think that, yes, we definitely need to get the word out there. How can we do that? Word of mouth. Those of us who have had this procedure, who are on the other end of it, who are not having any of those symptoms anymore, who are, our quality of life has completely changed because of the procedure. I think that we need to be willing to share that information for those who are struggling right now with it's a very big decision.
Yeah,
Having a
for sure.
hysterectomy, yeah, it's a major decision. And so I think that it would be nice to have someone else that's had that, obviously to know what the alternatives are to that.
Sure. Any issues with your insurance? Did you have any kind of pushback from your insurance company or any kind of issues with that whole piece of?
No, absolutely not. In any issues, of course, I'm one of these people, I do a lot of follow-up. So with that, just make sure you're following up, doing your part to make sure everything's covered. But for me, no.
Okay. All right. That's super. Well, I'm out of questions. This was awesome. Thank you so much for taking the time. I know I've given your phone number to other patients and stuff like that, and I know you're always willing to help and help other patients. But I think we need this kind of so I'm very grateful that you've taken some time and doing this for us. So
Now, I will say with the insurance, and actually I've gone over that with you. My
yeah.
insurance, there were some issues, I think, because your office was fairly new and was a startup.
Oh, right. Because the provider numbers. Yeah. Okay.
Absolutely.
Okay.
But that is something that,
Did all that get straightened out?
yes,
Okay.
yes.
Good.
I actually did hear from the person in your company
Mhm.
that handles all the insurance information. She's emailed me, and that's been taken care of. And
Oh,
that's
very
simply
good.
because I think you were just getting established.
Yeah. Yeah.
I'm
We
guessing
just,
I may have been one of your first patients here in this area, one of the
yeah,
first.
maybe the first 5, I think. Yeah, because we just opened in February, March. So I've been in Dayton for 18 years. And, Cincinnati, well, I think I told you, like my wife, I don't know if I told you, but my wife and I are empty nesters, and we're Bearcats. So we're from Cincinnati. So we had a master plan of like wanting to come back to Cincinnati after the kids left. And so we
Great.
have a place in Cincinnati, and I always had a dream of starting a practice in Cincinnati. So
So
uh,
grateful for that. Yeah, because my procedure was in April, so that was right after you were established here.
yeah,
So
yeah, yeah.
yeah.
Mm.
So I'm so grateful that you were
Well,
here
th-
during that
thanks for
time.
taking the time to do all the research and finding us.
Yeah,
So
thank you, thank you. I
yeah,
again, uh, I don't know. When I see you, if I give you like this big hug or something like that, just
no,
know
for
that I'm
sure.
not.
Well, what we'll do is like, if you have time, I do a lot of these community outreach programs, and we're taking this message now directly to the community. So if I get a chance, I'll invite you. And I think your story is so dramatic. You're a great communicator, which is fantastic. You articulate things really well. So, I mean, if it's okay with you, I'll invite you if your schedule permits, and I'd love for you to tell your story in person to some people directly. And it's all like some of this video stuff. I'm sure we'll get out there on social media and stuff. But aside from that, if you're up for it, I'd
I'd
love
love
to have
to.
you. Okay,
Absolutely
super,
would love to.
super,
That would be
super.
my way of giving back to my community.
Okay.
So absolutely, yes.
All right, super. I'll take you up on it. Well, all right. Well, have the rest of your weekend. Have a nice weekend. We'll catch up if you need
All right.
anything. You have my cell phone number. Just text me. So,
I sure will. Thank you so much, Dr. Moore.
all right. Take care.
Have a good
Bye bye.
one. Thank you.
Bye bye.
Bye-bye.